The following is a demonstration of the skill validation abdominal assessment and tube feeding via a PEG tube or a G-tube. Gather the appropriate supplies. You will need the appropriate tube feeding per doctor's order, tap water, 60 milliliter catheter tip syringe, 3 240 milliliter graduated cups, a bath towel, emesis basin, stethoscope, and pH paper per hospital policy. Wash your hands before entering the patient's room and provide for privacy. Introduce yourself to your patient and explain what you will be doing. Check the ID band name and number, compare with the order sheet, read it out loud, and have the patient state his or her full name. Check the doctor's order for the ordered tube feeding. Assemble the supplies on the bedside table. Pour desired amounts of flush solution and tube feeding. Pour 30 milliliters of flush, tap water, 60 milliliters of flush, and make sure to get down at eye level to verify the amount when measuring. Measure the amount of ordered tube feeding in your middle cup. Put the head of the bed down to 30 degrees. Do not put a patient who is receiving a tube feeding flat in bed. And continue to pour desired amount of tube feeding. If necessary, raise the height of the bed to a comfortable working position. Uncover the abdomen. Inspect the abdomen first, looking at contour, looking for distension or any scarring. Ask the patient the date of the last BM and usual bowel habits. Next, visually divide the abdomen into 4 quadrants. Swab the stethoscope with alcohol at the diaphragm. With your stethoscope, listen or auscultate in all 4 quadrants, listening for the presence of bowel sounds. If exposure to blood or body fluids is expected, don work gloves. This patient is clean and dry and work gloves will not be necessary. Lightly palpate the abdomen in all 4 quadrants, assessing for any tenderness, lumps, or bumps in the abdomen. This completes the abdominal assessment. Position the patient in semi or high Fowler's position. Don your work gloves. Place a towel on the abdomen to protect the patient and bed from any spillage. Verify the placement of the PEG tube. Visually inspect the tube length and that it is intact in the abdomen. Unclamp the end of the tubing, pinching the tube just below the connection to prevent spillage of gastric contents. Attach a catheter-tipped syringe to the end of the PEG tube. Aspirate gastric residual, assessing color, consistency, and amount. If gastric residual is less than or equal to 100 milliliters, return the residual. Gently return all but a scant amount, saving for a pH test, and reclamp your tubing. Test pH according to hospital policy. Take the syringe plunger off and gravity flush the PEG tube with your 30 milliliters of water. Pinch the tube between to prevent air from entering the tube. Administer tube feeding by gravity via the PEG or G tube slowly as prescribed. The rate that the fluid is administered can be adjusted by rising or lowering the height of the syringe. Allow all of the tube feeding to enter by gravity. Flush the tube with 60 milliliters of water. And reclamp your tubing. Leave the head of the bed elevated after feeding. Discard your work gloves and cover the patient up. Lower the height of the bed if it was raised. Wash your hands. And document abdominal assessment, presence of bowel sounds, placement check, amount of residual, amount of flush, type of tube feeding, and any patient complaints.